Hello everyone. Welcome back to the channel. In today's video, I will demonstrate the complete step-by-step carving of a permanent maxillary central incisor. This demonstration is specially designed for beginners and follows an exam-oriented approach suitable for a 2-hour dental anatomy practical. So let's begin. First, let us see the armamentarium required. We need a wax block, a BP blade or wax carver, a divider, a pencil, and a scale. Before starting tooth carving, we must first remove the rough waste wax and make the wax block smooth and even. This step helps in accurate marking and controlled carving. First, take the wax block and hold it firmly. Observe all surfaces and identify irregularities, sharp edges, and uneven areas. Using a BP blade or wax carver, gently scrape the surface of the wax block. Always use light pressure and move the blade in one direction. Do not cut deep into the wax. Our aim is smoothing, not shaping. Remove wax from all sides: labial, lingual, mesial, distal, incisal, and basal surfaces. Check the block frequently by rotating it in your hand. All surfaces should appear flat, smooth, and uniform. If required, lightly warm the blade to get a smoother surface finish. Once all roughness is removed, the wax block becomes ready for marking and carving. This completes the step of removing rough wax and smoothing the wax block. Take the wax block and hold it vertically. Identify the center of the block. Now, draw a long axis line on all 4 sides of the wax block. This step is very important to maintain symmetry while carving. Now we proceed to mark the midline. Draw a straight vertical midline on the labial surface along the long axis. Similarly, extend the same midline onto the lingual, mesial, and distal surfaces. Ensure that all midlines are in one straight line and aligned with the long axis of the wax block. This step helps in maintaining symmetry and proper tooth form during carving. The next step is marking all the aspects. Using a pencil, label the surfaces as labial surface, lingual surface, mesial surface, distal surface, incisal surface, and root surface. Correct identification of all aspects is essential before starting carving. Now we proceed to taking the measurements of the crown. Using a scale and divider, measure the crown length, which is approximately 10 to 11 millimeters. Mark this measurement from the incisal edge to the cervical line. Next, marking crown and root length, mark the cervical line around the wax block. The crown length of the permanent maxillary central incisor is approximately 10 to 11 millimeters. The root length is about 13 millimeters, which is longer than the crown. Clearly mark the crown portion and root portion. Now we proceed to measure the root length. Using a scale and divider, measure the root length, which is approximately 13 millimeters. Mark this measurement below the cervical line, along the long axis of the wax block. Ensure the root length is longer than the crown length. Accurate root measurement is important to achieve proper tooth proportion and anatomy. Now we proceed to measure the mesiodistal width of the crown. Using a divider, measure approximately 8 to 9 millimeters, which represents the mesiodistal dimension of the permanent maxillary central incisor. Transfer this measurement onto the incisal surface of the wax block. Mark the points equally on both sides of the midline. Remember, the mesial side is relatively straight, while the distal side is more rounded. Ensure the markings are clear and symmetrical, as they guide the outline formed during carving. Now start removing excess wax slowly. Shape the crown into a rectangular block form. At this stage, keep the incisor edge flat. Do not carve any surface anatomy. This is only rough shaping. Now we measure the labiolingual width of the crown. Using a divider, take a measurement of approximately 7 mm. Transfer this measurement onto the wax block. From the labial surface to the lingual surface. Ensure the marking is centered along the midline and evenly distributed on both sides. This step helps in maintaining the correct thickness of the crown. Now start removing excess wax slowly. Shape the crown into a rectangular block form. At this stage, keep the incisor edge flat. Do not carve any surface anatomy. This is only rough shaping. Now we proceed to measure and mark the labiolingual and mesiodistal width at the cervical region of the tooth. First, identify the cervical line that separates the crown and root portion. Using a divider, measure the mesiodistal width at the cervix. This width is slightly less than the incisal mesiodistal width. Transfer this measurement carefully onto the wax block at the cervical region, keeping the marking centered along the midline. Ensure the mesial side is relatively straight, while the distal side is slightly more rounded. Now we move on to the labiolingual width at the cervix. Using the divider, measure the labiolingual dimension at the cervical region. This width is narrower than the labiolingual width at the incisal region. Mark this measurement on the wax block. From the labial surface to the lingual surface, exactly at the cervical level. Make sure both labiolingual and mesiodistal markings are symmetrical on either side of the midline. Rotate the wax block and recheck all markings. From labial, lingual, mesial, and distal views, accurate cervical measurements are essential to achieve proper crown contour and emergence profile during carving. Now we proceed to mark the shape of the crown on the mesial and distal sides. First, observe the mesial surface. Using a pencil, draw a slightly straight outline from the cervical line to the incisal edge. The mesial outline should be less convex and more straight in appearance. Next, move to the distal surface. Mark the crown outline with a more rounded and convex shape from the cervical region to the incisal edge. Remember, the distal side is always more convex than the mesial side in a maxillary central incisor. Next, move to the labial surface. Carve the labial surface to make it smooth and convex. The maximum convexity is present in the cervical third. The labial surface of the maxillary central incisor is generally smooth, so avoid creating deep grooves or sharp lines. The maximum convexity is present in the cervical third. Now turn the block to the lingual surface. Carve the cingulum, which is well developed and slightly placed towards the distal side. Next, carve the mesial marginal ridge, distal marginal ridge. Between these ridges, create a shallow lingual fossa. Remember, the lingual surface is narrower than the labial surface. Carve the cingulum, which is well developed and slightly placed towards the distal side. Next, carve the mesial marginal ridge, distal marginal ridge. Between these ridges, create a shallow lingual fossa. Remember, the lingual surface is narrower than the labial surface. Now observe the tooth from the mesial view. The outline should be triangular in shape. The maximum convexity is present in the cervical third. The incisal edge is positioned slightly labial to the center of the tooth. Next, observe the tooth from the distal view. The distal surface is more convex than the mesial surface. Now proceed to carve the root. The root is conical in shape. Tapers gradually from cervical to apex. Shows a slight distal curvature near the apex. Avoid over-thinning the root. The root is conical in shape, tapers gradually, and shows a slight distal curvature near the apex. Avoid over-thinning the root. I repeat, avoid over-thinning the root. Finally, smoothen all the surfaces. Remove sharp edges and irregularities. Check the tooth from all views. Labial, lingual, mesial, distal, incisal. Compare the carved tooth with a reference diagram and ensure correct proportions. Now shape the incisal edge. The mesio-incisal angle is sharp and well defined. The disto-incisal angle is rounded. The incisal edge slopes slightly towards the lingual side. Next, we mark the curvature lines on all aspects of the tooth. On the labial surface, draw a gentle convex curve with maximum convexity in the cervical third. On the lingual surface, mark the cingulum and a shallow fossa. On the mesial surface, draw a slight triangular curvature, sharper toward the incisal edge. On the distal surface, mark a more rounded convex curve. Finally, lightly indicate the incisal edge curvature from labial and lingual aspects. These lines will guide accurate carving and symmetry. And that's it. Both the right and left permanent maxillary central incisors are now fully carved and ready. If you enjoyed this video and found it helpful, don't forget to subscribe to our YouTube channel and follow our Instagram page for more updates, tips, and demonstrations. Stay tuned, because in our upcoming videos, we'll show you the step-by-step carving of permanent maxillary lateral incisors and other teeth. Hit that subscribe button, turn on notifications, and join us on this journey of mastering dental anatomy and carving. Happy carving, and see you in the next video.